There you go. At 12 people.
Okay. Welcome to October 24th meeting of the Health Services Committee. We sincerely hope that Edmund Frazier is better, gets back to Warren County and comes back to chairing this committee. So can I first get a motion to approve the minutes of our prior committee meeting? From Supervisor Williams, seconded by Supervisor Etu. Any discussion, comments? All those in favor?
Aye.
Approved. Thank you. Privilege of the floor and comment. Is there anyone out there that would like to address, talk to us? Seeing none. Rob, why don't you jump on stream here?
Good morning, everyone. I just have one item this morning. This is a request to renew our office space lease agreement with the Warren Washington Association for Mental Health. We've been in that location a number of years and it works well for us. It's situated on Maple Street, 230 Maple Street downtown, Glens Falls, and it situates us kind of in between the two municipal centers since we cover both counties and we're back and forth. We're co-located with one of our largest providers, so it allows for a lot of collaboration and working together with them. So this would be a 2-year lease. The amounts are on my request form there. Rob Lynch assisted me in breakout between the principal and interest lines, and these funds are accounted for in our 2024 budget submission.
Yes, yes, Supervisor Rossi, second by Supervisor Smith. Discussion. I can haven't attended in past years some of the meetings. I can totally agree with you that it's a good location. I think it's a well-designed building in terms of the way it is laid out, and I think in its location, I think in terms of Washington County conveniently coming to the structure in the meetings, it makes sense. So I would confirm and agree with your comments, Rob. So all those in favor?
Aye.
Approved. Thank you. Thank you, Rob.
Okay, that's all I have. Thank you.
Thank you. Appreciate it, Rob. They're on their way.
So we do have an updated agenda. Thank you. That would probably be most helpful to.
You know,
Yeah, that attachment 7.
good morning, resolution number 1 to amend health services therapist contracts. Go ahead.
So this is request to amend our health services CHA, our home care therapy contracts to reflect the establishment of a $15 rate for OASIS discharge, which will be added to the current rate schedule, which is in attachment 1. In the previous electronic medical record, the therapy supervisor could facilitate discharge electronically on the therapy patient. However, with our new electronic medical system, the therapist has to actually do that, which is creating additional work. And we felt that we needed to put a rate there to reflect their time. And we did utilize our meeting rate time for the additional 15, or I think it was additional 30 minutes was $15. So that's where we came up with that.
Good, thank you. Can I get a motion to put that on the floor? Supervisor Runyon, seconded by Supervisor E2, discussion. Seeing none, all those in favor?
Aye.
Approved. Resolution number 2, to enter health services to enter into an agreement. Go ahead.
All right, so this is actually attachment number 7. This was an add-on request to authorize health services to enter a New York State Department of Health early intervention grant contract to accept funding. The grant period is October 1st, 2021, not a typo, to September 30th of 2026. The amount of the funding is $142,645, which is broken down at $28,529 annually. In addition, we're requesting to authorize health services to receive any additional funding in the event more funding becomes available. This is federal funding provided by the state health department for the early intervention program, which serves eligible children birth to 3. This is a 5-year grant that did begin in 2021. We're about to enter the 3rd year. They're looking for a grant to be contracted, and we couldn't find that we had ever had a signature, but that all happened during COVID, so I don't know. So I take support on that.
Okay, can I get a motion to put that on the floor, please? Supervisor Runyon, second by Supervisor Brewer, for discussion. Seeing none, all those in favor?
Aye.
Thank you.
I just, if I could real
Sure.
quick, Chairman, the money is already in our budget, so somehow magically we were already having that grant, so it's just to clean up the.
Good, thank you.
authorization.
Thank you, Janelle. Just to discussion items, report of revenues and expenditures for 2023. On.
Yep, that's me. Attachment number 2, our current status as of October 12th with our revenues and our expenses. Again, to reflect that I did put in for the month of August for WIC, which is an include in the revenue and WIC grant, and September. So you'll be seeing September next month. Down below with our salaries, you'll see that we're doing pretty good with salaries right now. We're at 49.92% of budgeted. And last year we were at 72.23%. And again, that was because in the past years, obviously we had COVID, and that's what we expected. Attachment number 3, which is comparing the year before. The biggest thing that is the difference between the 2 years is we got the grant for the schools and to give them equipment. So under equipment, it reflects an additional $250,000 year to date for purchases. And I do want to note that we just yesterday received our second payment. So we have billed for all of this year, and we've gotten all over, I think it's almost $600,000. So we did receive all that in 2 checks, one from January to March. And yesterday I received it from April to July. So that grant is done. Everything we did for the schools is now paid for. So that's good. Everything else is pretty much the same. Again, benefits are down, contractual expenses, which is everything but salaries pretty much and fringe. That has again got supplies in there that are reflected with the school grants. And again, like I said, that's all been paid for. So we're all good there. We won't see those anymore for the rest of the year. And the revenues, again, we're year to date, slightly above, it looks like, because of everything that's just in timing of billing. One of our things is always the preschool program, trying to get everything there. We also, the home care division, we have the new system, and we're going to close September for today because we're just trying to understand all of that. And we're going with the new system. So hopefully the old system will be done by the end of the year.
Wonderful. Go ahead. No.
The rest are our typical handouts that we give you. 4A, 4B is our home care summary of our visits. There is a pretty significant dip, but in August, we weren't taking any additional referrals so that we could train our staff to the new system. So that's reflective of that. We have a rabies report and our emergency preparedness report. And if I could, what I would like to do is give a little tribute to Pat Auer, who was our director that passed away. Your last attachment is a form that I presented at our NYSETRA meeting. And I just wanted to say a few words in her memory, if that is okay.
Please do.
Might be a little bit more than a few.
Yeah.
It is a privilege to be before you today and pay tribute to Pat Auer's legacy and share some of her contributions as a public health leader. She modeled the best at all times. Warren County has only had 3 public health directors. As you may know, Joan Grishcott, the first public health director, was also amazing. She began her career in Warren County in 1960, and she served until her retirement in 1997. Joan and her husband Walter started the Adirondack Balloon Festival, which just celebrated 50 years this past September. Unfortunately, Joan passed away July 8th, 2021 at the age of 79, and she was still active in a lot of boards at that time. Pat Auer, who had been with our agency since 1986 in various leadership positions, assumed the public health director role in 1997 after Joan's retirement. She stayed here until her retirement in 2018, and Pat served 21 years as our director. She retired just in time from COVID perspective. However, she remained close and just a phone call away. Pat was born in New Hampshire, grew up in Chestertown, New York, in Warren County. Lets you know. She's the oldest of 5 children and paved the way for her 3 sisters that chose nursing as a career as well. She earned a bachelor's degree in nursing from Mount St. Mary College in Newburgh, New York, and perhaps the most useful degree she earned was a master's degree in counseling and community health from Fairfield University in Fairfield, Connecticut. She began her public health nursing career in a combination role as a school nurse teacher and a community health nurse, focusing on maternal child health and children with complex health needs, focusing on maternal child health and complex health needs. It was there her daughter remembers seeing her compassion working with special needs children and ensuring her office was welcoming and a safe and happy place for all. Later, her daughter would see Pat when she worked with the county for many countless hours on the phone at the kitchen table before cell phones, on weeknights, weekends, and holidays, taking calls and patiently addressing all the public health concerns that came her way and assisting those in need. In 1986, Pat came to Warren County and initially serving as our home care supervisor, and she volunteered to build our public health programs now housed in our preventive programs. In 1997, she became our public health director and retired in 2018, as mentioned. She lived in my neighborhood. I was thankfully able to stay connected. I could say hello on my walks, enjoy periodic lunches with her, and call just to check in. She was always there and always wanted to know what was new in Warren County. She was also willing to volunteer, which she did throughout the pandemic. She helped with my annual staff appreciation preparations as well. This year, she helped me fill May baskets for the May Day and filled the piñata for Cinco de Mayo. Pat described her tenure. Every day was exciting, but some memorable challenges. Also, in her words, I think there are weeks where I accomplish things, and there's weeks when I say, oh God. I'm sure you all can relate. In 1992, these are some of her her accomplishments here. We had a high school measles outbreak, New York State spectator-less basketball tournament. Sports and disease outbreaks are never fun. Although Pat was selected as Warren County's Nurse of Distinction that year, she wasn't able to make that recognition ceremony because she was pretty busy with measles. Among some of the measles challenges were, because it was a high school case, there were students in Spain that needed to get home that had measles too. In 1993, she saw rabies become an endemic county, which meant we had our first positive fox in Warren County, which was in Queensbury. In 1996, you might remember our hepatitis A case in a restaurant worker right during Balloon Festival weekend, where we prophylaxed over 4,000 in the region, state, country, including internationally. We tracked down people through their receipts at the restaurant. And that very same week, we also had a rabid fox bite 2 people, including a 5-year-old in Pottersville. And we had a lead case in a 1.5-year-old, which was a 98 microgram per deciliter lead level. Although there's really no follow-up, there is no normal lead, but under 5, we don't do intervention. So a 98 was quite significant. In 1999, E. coli 0157 outbreak was associated with the Washington County Fair. In 2000, we had a human rabies case in West Nile, became a new emerging pathogen. Pat actually went to mosquito school, which is where all the New York State health directors went at Mosquito University, and we decorated Pat's office appropriately when she returned. In 2001, we had 9/11 and the emergency plans began. In 2009, we had H1N1, where we did experience a death on Halloween, which incidentally was the case's 40th birthday. SARS, Zika, Ebola, all that went into Pat's tenure. For those that knew Pat, she was an exemplary leader. She believed in team, collaboration, and respect. She was hardworking, dedicated, fair, consistent. She did not like the word boss, but gained respect of all those that worked for her through her professionalism and respect. She was a very quiet leader, but when she did speak, all listened because she had great insight no matter what the issue was. She was calm, flexible, and unexpected yet urgent situations, as I described above, especially when public health and safety were at risk. She never lost control in my 29 years of knowing her. She was very trusting of her staff. She always looked for the ounce of positive no matter the situation. She believed in her staff, put their needs and the needs of their families first, knowing that they needed to be whole before they could help others. As a professional woman, she seamlessly balanced the needs of her family and work in addition to volunteering. She served on the Queensbury Union Free School Board for 15 years, including serving as president. She was on the school board, incidentally, at the time there was the measles outbreak in 1992. She always seemed to have the right balance as she bounced many balls without missing a beat. She made chaos look calm, controlled, and easy. She provided a safe environment for staff to grow, believing in them, trusting in them, advocating for them, and always there to help in those difficult times when lessons were to be learned. She was always positive, and there was always sound advice when requested. She also ensured our agency was professional, friendly, and provided obstacle-free service to the community. Recently, we had National Customer Service Week, and it seemed fitting to remember Pat and her contributions. She was responsible for finding our agency's motto: do all the good you can, by all the means you can, in all the ways you can, at all the times you can, to all the people you can, as long as you ever can. And that was from John Wesley. Last page. Pat was married, had 2 children and a granddaughter, for which she was a dedicated and loving wife, mother, daughter, and grandmother. Pat hired me in 1994, and I had the pleasure and honor to work for her and work with her. She was an amazing role model, boss, mentor, and friend. In addition to her family, our community, and our county, she also meant the world to me and will be sorely missed. I will remain grateful for the many lessons that she so quietly taught about life, family, public health, and service. My thoughts continue to be with her family and loved ones, and I do thank you today for your time and attention to let us reflect on Pat's legacy. I will end with her advice from a paper she wrote and submitted to the New York State School Boards magazine in 1992 from the measles outbreak. Care, consistency, cooperation, and positive team effort. Those were the words she used and the tools she used to light her way through all the moments of crisis. When she retired, she was quoted as saying, "Every day was a bit of adventure. I can't say that I haven't enjoyed it." May you rest in peace. Job well done.
Thank you, Janelle. Thank you very much for the very touching and excellent commentary. I was a neighbor and friend of Joan Grishcott, and Joan and Pat and yourself have always exemplified the finest, in terms of human qualities and effectiveness in Warren County government. So we thank you for that, and again, thank you for your comments this morning. Thank you.
And I just have a few meetings and conferences.
Okay, great.
We had authorization for Marie De Lorenzo to attend a virtual home care based assessment forms pathways training. That's going to take place in November in the amount of $1,121.25, and that funding is in our budget. In addition, we got authorization for Valerie Wisna, our Assistant Director of Patient Services, to attend Home Care Association's virtual Emergency Preparedness Conference, which will be held in November as well. That conference is $179. We also had the funding in our budget. Finally, happy to report we hired 2 nurses. They're doing very well. We received authorization for the 2 nurses, Shauna Joseph and Olivia Jones, to receive virtual training on our patient review instrument and screen. Each had to take 2 courses, the online screen training and the community patient review. And the total cost for both trainings for both nurses was $1,100, which was also in our budget. And that's all I have for today.
Thank you, Janelle. Any items that any committee members have? Privilege of the floor. Seeing none, can we get a motion to adjourn, please? Supervisor Bruno, second by Supervisor Runyon, you're adjourned. Thank you very much.